anything done before on my back or adjustments or anything like that. So sometimes I'll have pain like in my back.
Okay, so you've never been adjusted before. How do you feel about it? Are you nervous? Are you
Oh, yeah.
excited? You're nervous? Okay.
I'm afraid it's gonna hurt a lot.
Okay. Well, it's okay to feel that, and I understand that you feel that because it's new and you've never done it, and maybe you've never even talked to anyone who's done it. But there's very little of pain, if any at all, associated with chiropractic adjustments. As a matter of fact, one of the things that I do best is help you relax to a point and explain everything to a point that actually makes you feel really comfortable before getting adjusted, which helps you relax, and then it doesn't hurt at all. Most of the time, it actually feels really good.
Yeah,
So
my one friend said, she was like, you're gonna feel amazing afterwards. I'm like,
Yes.
okay.
Yeah. All right, so you have neck pain, shoulder, sounds like tension, pain sometimes.
Work at a desk, and I feel like my whole desk ratio to where it's probably not good. I'm pretty flexible, so I was a gymnast for very many years.
Okay.
So it's not, my back's pretty intense.
Okay.
Moves a lot.
Do you exercise still?
I do a lot of yoga.
Okay, very good. Do you ever have any headaches?
Yes.
How often do you have headaches? Weekly, monthly?
Monthly.
Are they period related? Before or after?
Before and during.
How much water do you drink?
Not enough.
Okay.
I know that.
Coffee?
Oh yeah.
How much coffee?
At least 1 to 2 cups a day in the morning.
All right, how far back can you remember getting the headaches? Is that something that you had as a teenager?
No, it's been like a couple of years.
Okay, how old are you now? You're 32?
32.
And so,
I had eye surgery when I was a baby. That's
Okay.
about it.
was there trauma or?
And now my eyes are weird. My muscles weren't, I guess, strong enough. So like my eye would just start moving.
Okay. Okay, do you know the details of your birth? Do you know how you were born? Was it cesarean or natural?
I'm pretty sure it's natural.
Okay, do you know if there's any complications, any shoulder dystocia? Did
I know that the doctor used some kind of tongs to
Okay.
pull me out, and my parents were pissed. I know that. There's apparently, I think, I don't know if it's still there, but there was like a little divot somewhere in my head
Okay.
from it.
So typically, or I have to say more recently, there's a very adverse reaction to that instrument because forceps is what they're called. Forceps deliveries aren't optimal. You know, they're used when something's stuck. And so, but I've actually talked to midwives who told me that there used to be an art of forceps delivery where you could use them to naturally curve and just to kind of pull the birthing child out in like this vortex manner. Like it never was meant to be like a straight pulling, yanking.
Yeah.
And it was supposed to be this very biological, organic motion that if you had the art to it correct, that babies could be born with less trauma. But now that art just doesn't seem to exist anymore in modern birthing practices, so the forceps delivery has become more traumatic.
Yeah.
All right, that's okay. How about any sicknesses as a child besides the eye surgery?
Lots of ankle twisting and spraining from gymnastics and cheerleading. Lots of that. And I had like chicken pox.
Okay.
My parents forced me. My brother had it, so they were like, "And now you're gonna have it."
Oh, cough in her mouth. Yeah.
Do it.
So we've got some ankle injuries. Any knee pain?
Yeah,
Which side?
both my knees. I
Okay.
get pain and hips. Like I'll do yoga sometimes, and I'll get like a huge pain. Like my hip feels like it's out of place,
Okay.
and I have to like go down and like wait for it to subside.
Okay.
All from gymnastics.
Okay.
Did a number on the lower body.
All right. How often do you get the knees and hip pain? Is that like every time you do yoga, or weekly while you do yoga?
Probably like weekly.
Okay.
If I do, there's certain things, if I do like crunches and stuff that I'm like moving, like you'll be able to hear like my hips popping or like my knee popping. It's kind of gross.
It's not gross. It's fine. No, it's fine. So we'll start off. I'll do an exam on your spine, and then after that, I'll walk you through an adjustment. I'll explain everything as I'm doing it. We'll practice the adjustment, so there won't be any surprises, and we'll make sure you're completely comfortable and ready to get adjusted at that time. Okay?
Yep.
All right. Let's see what your spine says and get you adjusted.
Okay. Oh, I did have
spina bifida?
No. The one where it's
Meningitis.
not.
Scoliosis.
Yes. I had that as a child.
You had scoliosis as a child?
I did.
There's a slight loss of arch here in your thoracic spine where like it kind of like comes out here, like it's gonna start arcing, but then it just flattens out right here. So this is very even in temperature and tone. I can start to feel a little bit of the asymmetry here where these muscles are hypertonic. And it seems as if there's a slight rotation in your spine here in the lumbar, in the thoracic lumbar transition. So a little bit of postural changes here, but nothing that I feel like is a red flag. There's no huge curvatures here. We're going to check for scoliosis again in the standing position. That means that even though the curve is diminished here, it's not stressed. Underneath of it, though, is where we're getting the reading. First thing I'm going to do is look at your leg length. I'm going to center you on the table. Okay, and then looking down. We've got a short on the left. Now let's test it. Go ahead and push your legs out to the side. Push, 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 push. Relax. Good. We've got a left short. I'm going to test this. I'm going to push down into your sacrum, okay? Do you have any pain, discomfort when I press here?
Not really.
Here? Any tenderness here?
Yeah, a little bit.
So the left is short and then it stays short. Good. Right side. And that balanced you out. When I put the blocks underneath of you, it balanced out. So that tells me you don't really have a short leg. You just have a twist in your hips. We untwisted it when we put the blocks underneath of you, okay?
Mm-hmm.
Okay, just let your shoulders relax here. There you go. Tender.
A little bit.
Tender.
Mm-hmm.
And I'm just looking for muscle fibers that are tense. Very good here overall. Is that tender here?
A little bit.
Slight tension. These are all the muscle fibers from the trapezius muscle. Okay, I'm going to do a stretch of your spinal cord. I'm going to start with contacting the sacrum here. And we're going to do an oppositional traction on the occiput. Moving with the rhythm of your breath. As you breathe out, we're just going to gently create some traction space here. Releasing on the in-breath. Pushing on the ex-breath. The out-breath. Expiration. Got a nice gentle breathing, Felicity, just letting everything sink in, letting your back sink into the table. Good. See, it's cracking already because you're relaxed. Does your back crack on its own a lot? Okay, Felicity, so what you're going to do, you're going to take a deep breath in through your nose. I'm not adjusting you yet, it's just practice. And then out through your mouth. Good, and then as you breathe out, I'm going to follow your breath like this with my hands, and then at the end of your breath, right about there, we just push like that in that direction, okay? How do you feel about it? You nervous still? Okay, that's okay to be nervous because you're actually relaxed here. You're doing a good job. Just let your shoulders and back sink in as much right there. Do you feel that? How you just let go? It's exactly what you need to do. You're doing perfect. This is going to be gentle, okay? Okay? Okay, let's try that again. Deep breath in through your nose. Good. Out through your mouth and just let everything sink in. Gentle, gentle. Was that terrible? Was there any pain? Did you feel the release? There was a big release. Now, did you also feel the tension too? Like, could you feel your muscles kind of resisting me just a little bit there? Yeah, that's that tension I was talking about. That's not you not relaxing, okay? You're relaxed as far as like letting go, but you just have this inherent, very mild tension in your spine. That's the tension that you can't normally feel, but after I adjust you, you will feel the absence of it. Okay, same thing. You're going to breathe in through your nose. out through your mouth. Good, and sinking in, just letting it all sink, shoulders, hips. Okay, so this one's a little bit different. This time you're gonna take a deep breath in, and then at the top of your in-breath, then we're gonna push like that, okay? Okay, another deep breath in, far in as you can go. Good, end out, breathe out. Good, let your shoulders relax. Silent, but deep. Very good. So how was it? Did any of those hurt? Are you less nervous now?
Yeah.
The other ones feel like this too.
The neck is what.
Alright, we'll get there. So this is how we adjust the low back. Okay, we're gonna bend the top leg. Good. Bottom leg stays straight. I'm gonna scoot you forward to the end of the table here. We'll bring your shoulders just a little bit more forward here too. Okay, good, Felicity. Okay, nice gentle breathing. Good. You're doing great, okay? Good. So for this adjustment, I'm gonna traction your shoulders in this direction like that. We're gonna bring your hips down like this. Then I'm gonna push your hip in that direction like that, okay? Okay, same thing. Okay, breathing softly. Good. In through your nose. Again, in through your nose. Out through your mouth. Good. Let the shoulders come up this way. Good. Gentle. Okay, same thing. I'm going to be tractioning your shoulders in this direction like this. I'm going to bring your hip down slightly and push. We're going to push in this direction that time, okay? Okay, deep breath in through your nose. Out through your mouth. Bring your shoulders up here. Lay on your back. Okay, this is how we check the neck, okay? So left is still short in the supine position. So what you're gonna do, please turn your head to the right. Okay, back to center. Okay, so it got more uneven that time. Now, turn your head to the left. Back to center. It got slightly less uneven that time. One more time, turn to the left. Good, that's good. It's moving towards equal when we turn to the left. Now let's do this, let's check that. Bring your left ear down to your shoulder. Okay, back to center. And that also became more equal. Now bring your right ear to your shoulder. And that became less equal. Okay, back to center. Good, let it relax, let your head relax, good. I'm like, do you feel that right there, that little bubble? That bubble is edema, it's like swelling. And swelling occurs in the joints because all joints work like pumps. As long as a joint is working properly, it pumps fluid in and out all day long. But when a joint becomes stuck, either from gravity or posture at your desk or birth traumas, that pumping mechanism is disabled, and so no more fluids are exchanged. And over time, that leads joints to dehydrate and eventually degenerate. But in the meantime, one of the ways that we'll find joints that are stuck is by locating the edema, like that right there. So we'll start off on the right side. Let's practice it first, okay? Just so you can kind of feel what it's like, because I can feel you kind of getting tense a little bit. Okay, but let's just go through the range of motion just like we did before, okay? Okay? All right, so I'm gonna bring your head over to the side. We're gonna come to right about here. And then from right here, right there. We're just gonna push in that direction like that. You're doing good. Right now, you're perfectly relaxed, Felicity. You don't have to do anything else except for that right there. Okay, can you do it? Mm-hmm. You can do it. Okay, breathing. This is gonna be gentle, okay? Gentle, gentle, gentle. Good. Nice gentle breathing in. Good. Good breathing there. Nice and loosey-goosey here.
Mm-hmm.
Did it hurt?
Felt weird.
But did it hurt?
No.
All right, I'm going to adjust the left side now. Same thing, Felicity. Gentle, gentle. Okay, let your head sink into the table here. I'm going to test 7, 6, 5. I'm not counting down. I'm just testing segments. 4, 3. This is all in the upper to mid. Let's just see. So here's 2, 3, 4. What do you feel more? Here?
Mm-hmm.
Here.
Mm.
Middle or the top?
I think the middle.
Okay, let's go in a little bit deeper. Do you feel that? Do you feel that right there? There's a tiny bit of edema. Tender?
Mm-hmm.
Tender?
Mm-hmm.
Not as much. Here. 2. Good. Nice and gentle breathing. We're pushing in this direction like that. Good. Take another deep breath in through your nose. Out through your mouth. Let your head drop in. I just have to say, for a gymnast, there's not a whole lot of laxity in the ligaments of your ankle. It feels very structurally stable in here. All right. Okay, ready? Gentle. No, just relax. Just breathe. Don't wince. Just breathe. It's fine. No, stop wincing. It makes you tighten up when you do that. The smile is good, though. Relax. I can't crack one of them. Not one of them left to crack. There's some serious tension in here that it won't release. This is a big deal. This is much more serious than your neck. Your neck was fine. I'm really concerned about your toes. I'm going to pull them down like this, and then this is the ankle adjustment, okay? For the talus, we're going to pull in that direction, okay? Cool? Mm-hmm. Okay, your tibia and fibula are fine. These feel well supported, so the cracking most likely is coming from your patella. Let's just see what happens. Good. Oh, yep. Yep, that was your hip. Yeah, so it's all, and that's all quadricep too, because I can feel your patella tendon up here, which is the quadricep muscle comes into a tendon and then forms the kneecap or the patella. And then the hip flexors attach here proximally, and most likely you are hearing that same muscle just clicking over top of the bone, or it's not the joint cracking. No, so I can feel it right there. It's not the joint cracking. It's just the muscle kind of like going over the bone.
Mm-hmm.
So we're going to stimulate those muscle fibers here. Okay, push out, push, 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 push. Relax. Okay, now squeeze again. Hold your knees together, okay? Hold them together. Don't let me pull them apart. Hold. All right, so we start off by locating the ileocecal valve. Okay, this is the window in between the large and the small intestine. Okay, first we find the umbilical here in the ASIS. The point in between these two is where we begin looking for the valve. Okay, relax your belly. Breathe easy. Tender.
Mm-hmm.
Let's see. It's after 2 o'clock. What was the last thing you ate? Did you eat lunch?
Ate before we left.
Okay. Okay, breathe into your belly. Good belly breathing. All right, next one, pyloric sphincter 2 inches above the umbilical here. Okay, so this is a diaphragm muscle release. Do you ever do any singing or theater or acting?
I used to be in choir, yeah.
Yeah, so you know how to, your diaphragm and breathing with you, so you can do the belly breathing too. All right, so this muscle here, we're just going to begin by palpating right underneath the apex of the left ribs here. Good, following your breath. Good, as you breathe out, we just come right underneath the rib cage there. How's that? Is that tender?
Not really.
Okay, nice deep breathing. Found your french fries. They're in the ascending colon. Get in. And out. Okay, I'm going to raise the table up. This is a full spine adjustment, okay? So your hands are in a good place, just like that. Breathing is the same, nice and relaxed. I'm going to use this towel to support your cervical spine, okay? Mm-hmm. So we kind of go like this. And then I'm going to reach underneath with my fingertips and support your occiput like that. And then we're going to use the towel to traction in that direction, okay? Mm-hmm. Did something just crack just now?
I think so.
Yeah, it's a tiny little one. Okay, nice and gentle breathing in through your nose. Go close your eyes, nothing to look at. Breathe out. Good, now let everything sink in. So that was pretty good.
Ooh. Yeah.
I think we can do another one. This time you can be a little bit more relaxed. Because you tensed up a little bit there. Did you feel it? Yeah. Okay. We didn't quite get it all the way down. Okay, that's good. But now you know that didn't hurt, right?
No.
So now that you know that it doesn't hurt.
Weird.
It is totally weird. I get it. It's not, no one does, you can't, this isn't something you do every day or see every day. That's a good breath there, and you're much more relaxed this time. Good. So do that same thing. Good, and down.
Oh.
Did you feel it all the way down?
Oh yeah. Oh.
How's it feel?
Like jello.
You're back like this, so we're going to turn like this. Now squeeze your shoulder blades together. Good, tuck your chin in. Good, now look up at the ceiling. Can you go back more? Good like that. Yep. Good. Keep going back. Good. You're almost there. Gotta let your shoulders relax. Good. Now I'm gonna lift your head straight back like this. Good. Now let your shoulders relax. Good. I'm gonna tip this back here. Lift up your chin. No, lift up your chin. More chin. Good. Now let your shoulders relax. Right hip. Good. Okay, now I'm gonna do a series of drops. Good, now we'll do another diaphragm. Deep breath in. Out. Deep breath in. Out. Deep breath in. Out. Out. Good, look straight ahead. Very dehydrated in here. So you just, more water will increase the viscosity, or like how juicy the ligaments are. But when they start to get dehydrated, that's when they start to flop all around and get noisy and crackly. Scaphoid, lunate, it's like all three of them, and triquetrum, all three of them. Not supported. Go look straight ahead, sit up nice and straight. Hyperextended here too.
Oh yeah, that's my. Yeah.
Hyperextension, headaches too. You're on the spectrum of hyperflexibility here for sure. Hyperextended elbow, wrists. You need to drink more water.
Okay. I hate water.
What? You are water. You hate yourself? You hate 2/3 of yourself? Well, put some lemon in it and heat it up and call it tea. Yeah. Excuse me. It's a little bit weaker in the reproductive pulse. So did you just get done cycling? Mm-hmm. Okay. Mm-hmm. Do you think it's weird that I knew where your cycle was by your pulse? Mm-hmm. How do you feel?
Good.
Bouncy?
Yeah.
Loose?
Feel like I can do some backflips.
You're ready for some more floor exercises now.
Yeah, let's do it.